Hello, I'm Mark Harrison. I'm one of the doctors working on Smart Recovery, and I'm aware that some of the terms that we've been using a lot recently when we've been talking about the integrated care pathways are words like lean methodology, or Toyota production system, the Virginia Mason production system, or even just lean. Now, for our purposes today, they're basically the same. Unfortunately, the Trust doesn't provide any training in these, and it can be daunting to start. But I've had some training in lean, and I thought I should make a few videos to illustrate the principles. Now, unfortunately, I'm a really lousy director and I'm not very good at drawing, so I've reverted to what I know best, and I've got my Lego out of the attic. There are some misconceptions about lean. Lean doesn't mean just cutting staff. That doesn't work. Lean does mean relentlessly cutting out waste, and in healthcare, there is still an awful lot of waste. Often we're forced to waste time because the system is so badly set up around us. Allow me to illustrate with an example from my own experience, finding out my patient's blood results. I'm an old age psychiatrist, and we really like to know what's going on with our patients' physical health. And when I became the consultant in Tiverton, there was a process for finding out a blood result, but it was really wasteful. If I was lucky, I would have spotted that I needed to know a blood test result before the patient came in to see me. But often, it was in the middle of the conversation that they would drop in, "Oh, doctor's had my test result back. I can't tell you which one it is, and I don't know what it says." So, I would have to do the best I could in the interview, knowing that there was something else that could be going on, and I couldn't find out what it was. And after the patient had left, I would then have to go, walk the corridor, and speak to Anne, my administrator, to try and help me find out. She was always lovely about it, but I would have to interrupt whatever work she was doing to get her to find out the blood results while I saw my next patient. This meant that she had to call the GP surgery, who would fax some blood results back to her, often some hours later, and would then bring them for me to look at, and if they were the right ones, she would have to scan them onto Rio and then upload them. Now, these results may or may not have been the ones I wanted to know. After all, I never really knew which tests the GPs had requested, or what other information I hadn't been told. I could always rely on phoning the GP as a backup, but this would always risk interrupting them in the middle of something important. So, it was time to call a halt and fix the process. Now, blood results are just a number on a computer system, so I went about getting access to that system. It involved calling IT to upload a program onto my computer, had to complete a form, and then had to go to the RD&E for a 15-minute training session to make sure I used it correctly. Now, this means that the system is that when a patient turns around and says, "My doctor's had my test result back and I couldn't tell you which one it is," well, I then get to turn around, look it up, look up all of the other blood results I might want to know, and then get back to the conversation. This means that the patient gets a better medical response, and they get a clear answer there and then. I get to put that information into my notes straight away, and I've avoided wasting my time, the time of my administrator, the time of the GP's receptionist, and probably the GP too. Overall, we all come out of the deal pretty well, and this is lean. Now, imagine what happened if you made these sorts of changes to the whole system every single day.